At the White House, 11:49 here in London. President Biden is facing pushback, including from some of his own top health officials, including Dr. Anthony Fauci, after saying the COVID-19 pandemic is over. The president made that comment during an interview on 60 Minutes. Here's what President Biden said, followed by new remarks from Dr. Fauci.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape. And so I think it's changing.
But we are not where we need to be if we're going to be able to, quote, live with the virus, because we know we're not going to eradicate it. We only did that with one virus, which is smallpox. And that was very different. Of course, smallpox doesn't change from year to year or decade to decade or even from century to century.
Joining us now, U.S. Surgeon General Dr. Vivek Murthy. Dr. Murthy, great to have you with us this morning. So two very different views there of the state of the pandemic. Is the pandemic over?
Well, it's good to see you as well. I actually don't think they're all that different. What the president's reflecting is the fact that we've made tremendous progress against COVID-19. We're in a very different place now than we were at the beginning of this pandemic, with significantly lower death rates. We have all of our children back in school. We have people able to go back to work, families and friends able to see each other. But he also said, we have more work to do on COVID, and that's right. And that's what Dr. Fauci and others have expressed as well. We're losing about 400 people a day on average to this virus. We need to get that number lower. We have people who are struggling with long COVID. We need to understand more about long COVID and how to prevent it. And we also, thankfully, have a new updated vaccine that's available that can extend people's protection, strengthen their protection against the worst outcomes of COVID. We need people to take that vaccine. So there is more work to do, no doubt. But we are in a much better place than we were at the beginning of this pandemic.
Well, of course, that goes without saying. And I mean, people effectively are treating it like it's over. Here in London, where I am, I could count on one hand probably the number of masks I've seen in the last couple of days. New York is closer to that as well. But when the President of the United States says in no uncertain terms and says it twice, the pandemic is over, what should people watching this morning take from that?
Well, I think what people should take is that they should feel encouraged about the progress that we've made. I feel optimistic about how far we've come. We may forget just what it was like 2 years ago when schools were shut down, when people were not going to work, when we were worried about our own health and safety and the safety of those around us. But right now, if you are updated on your vaccines, and if you are a high-risk individual who uses a medication like Paxlovid, if you get COVID-19, your chances of dying from COVID are remarkably low. And that is hard-fought progress. But here's one thing I am worried about, Willie. In order to sustain this progress and to continue to advance, in order to develop the next generation of vaccines, especially mucosal vaccines that will help to block transmission even more effectively, we need to sustain our investment in COVID. So what we can do is look at this like an on and off switch, like COVID has disappeared. We've made tremendous progress, but we still have work to do that. It's going to require ongoing investment from Congress, ongoing investment in our country so that we can continue to make sure everybody in our country has the protection that they need from COVID-19.
Dr. Murthy, I appreciate that you're trying to thread the needle here between slightly different points of view, but one of the things that doctors around the world have said right from the very beginning is that clarity of messaging when it comes to a pandemic is absolutely essential. And whether you listen to the president or whether you listen to Dr. Fauci, the message is not clear coming out of the White House at the moment, and the risks are still high. You still have the potential for variants around the world. You still have countries where people are not vaccinated and they are traveling now, and the potential that they could bring new variants. So why take the risk from the president's point of view of even saying at all that this is over? Because some people will hear that and say, I don't need to get a booster if a booster comes around. I don't need to get vaccinated if I'm not already vaccinated.
Well, my job as Surgeon General is to tell people where we are and to talk to them about what they need to do. And the message here is clear, which is that while we should be encouraged about the progress that we have made, we still have to be vigilant and make sure we're taking steps to remain protected. And that means staying up to date on your vaccines, knowing where to go if you do get sick to get Paxlovid. And we have test or treat sites now available. People can go to their own doctor and get treatments for COVID-19 like Paxlovid. We want people to know what they can do, but it's also so important. This is something I learned when I was Surgeon General working on the Ebola and Zika crises, that when things get better, we can't, as a country, turn our attention away entirely. We've got to recognize that to stay in a good place and to continue making progress, we've got to keep our foot on the accelerator. We've got to not only continue to invest in better treatments, better vaccines, but we also have to look at the broader spectrum of issues that have been made worse by COVID. One of those, in fact, is mental health. This is an issue that I have been focused on as Surgeon General because I look at what's happened in our country during COVID, but also prior to COVID, and I see a mental health crisis, particularly among our kids, that has exploded. That's why I issued a Surgeon General's Advisory on Youth Mental Health in December 2021. It's why, as I wrote recently, there's more we need to do at a policy, programmatic, and individual level to make sure our kids are okay.
So, Dr. Murthy, I just want to go, you just started to lead us there, the idea of not letting your guard down when things are looking a little bit better. And we are, compared to other parts of the pandemic, in a little bit of a lull right now. But part of the reason why the president's comments raised such a stir is for months, health officials, including those employed by the U.S. government, have warned us about an impending fall or winter surge of the virus. Are you seeing any early signs of that? How should Americans be prepared? Should we be bracing ourselves for cases to really take off again?
Well, I'm glad you asked, Jonathan. Thankfully, right now, we are seeing cases continue to decline. Hospitalizations are coming down as well. That's good news. But look, if anything we've learned over the last 2 years, it's that we've got to be vigilant and we've got to be prepared, right? This is a time for preparation, not for panic. We've seen in the last 2 winters that we have seen a surge that's usually begun around late November or early December. But the best way to protect for that is to make sure that you are up to date with your vaccines. If you are 12 and up and you're 2 months out from your last shot, you are eligible to get the updated vaccine. And that's what we want people to do. The other thing you can do is pair this with your flu shot. The flu season is also around the corner. And so we want people to get their flu shot. Flu shot should be available very, very soon. And good news is you can go and get both shots at the same time, get it out of the way, and know that you have stronger protection against both COVID and the flu.
U.S. Surgeon General Vivek Murthy, thanks so much for your time this morning. We'll be talking to you much more as we move through this. Thank you.